Hey folks, and welcome back. So this week we are going to spend some time talking about the ethics of social distancing and mask wearing. Right? We've seen around campus, in the communities around campus at Widener, a spike in COVID-19 cases as people have returned to that community, even though they're not taking classes on campus, or some of them are taking classes on campus. They have returned to that community and are socializing with their friends, are having parties, and we've seen case numbers predictably start to rise as a result of that. And it's not just at Widener. We're seeing this all over the country right now. We're seeing case numbers rising at colleges and universities across the state of Pennsylvania and across the country as students have returned to campus and have done what students are going to do in this sort of situation. They've tried to skirt the rules a little bit in order to socialize with their friends. College students do it all the time. I don't know, why we would have expected it to be any different in these circumstances. In any case, these numbers have started rising, and it's alarming. Some schools are going entirely online as a result. So we've seen Temple University, for example, is switching to online entirely or nearly entirely online classes. Penn State is contemplating switching to entirely online classes. My alma mater, Gettysburg College, quarantined students in their dorms for some time this past week, and then made the decision to also switch to entirely online classes. Widener, however, is in the situation of having already made that decision to be almost entirely online, yet many students, not many, some students have returned to the communities around campus, and we've still seen these alarmingly rising case numbers close to campus. And so I want to spend some time today and this week thinking about the ethics of social distancing and mask wearing. In particular, I want to look at the question of why it is you ought to engage in these practices of social distancing, why you ought to follow these social distancing protocols and wear a mask when it is required of you or requested of you. I want to examine the sorts of reasons we might have for following these protocols. And that's what I'm going to do in this video and a few that follow it. We will look at the sorts of reasons that we have for these sorts of for engaging in this sort of behavior. And then this week when we meet in class, we're going to use what's been covered in these videos to have a bit of a discussion about appropriate responses from colleges and universities to student violations of social distancing practices. What should colleges be doing to enforce these practices? What are they justified in doing in order to enforce these practices? So let's get started by just talking about the point of social distancing. Why are we doing this? Why are we being asked to do this? Well, the whole point of social distancing is to reduce a value that epidemiologists call R naught. R naught is the number of people that each infected person can be expected to infect. R naught is affected by many factors, by density of a population, by immunity among the population, by the virulence of the disease. Some diseases spread very easily, some are much harder to spread. All of this affects R naught. What we knew about the coronavirus, the novel coronavirus, this spring and this summer is that R naught was somewhere around 2.5 in most populations where there was not and is not herd immunity. We could expect that each person would infect around 2.5 other people if they were interacting with one another. And the response that epidemiologists recommended was to, and continues to be, to limit social interaction. if we expose ourselves less, if we do things like wear masks when we're in public, like refrain from going out and socializing in public spaces, refrain from holding or attending large gatherings, and largely limit our interaction with other people outside of our own little bubble, then our knot will fall because we will not be interacting with as many people. If we can get R naught below 1, epidemiologists then consider a pandemic to be under control. The number of infected people is actually falling in that case. If R naught rises above 1, then the epidemic or the pandemic is off and running again. We start seeing exponential growth, as in this chart that I'm standing in front of now. So why should we worry about exponential growth in the number of virus cases? Well, we should worry about exponential growth because, well, the virus harms people. It kills people. It's killed hundreds of thousands of people over 100,000 people in the United States alone already. It's killed millions of people around the globe. So this virus kills people, and we ought to be worried about that. We ought to be worried about the well-being of these people who are suffering the worst effects of this virus. But we also have some other reasons for worrying about it. This virus has long-term effects on the individuals who become infected by it. We don't know what all of those long-term effects are, but we do know that it has effects on the arteries. We do know that it has effect on the lungs and lung capacity. We do know that it has an effect on the heart, and even that some patients who don't experience any symptoms or only experience mild symptoms when they are actually infected with the virus have some long-term effects from being sick. It's predicted that we'll see higher incidences of heart failure among such patients, for example, or among such people, for example. So we should worry about these long-term effects. It also affects the liver and kidneys. So we see that there are significant side effects to becoming infected with this virus. And we don't yet know what of them are. We don't yet know what the long-term effects are going to be. We also should worry about the effect that it's going to have on our health system. It prevents we want to prevent hospitals from becoming overwhelmed with virus patients so that they can continue to treat patients who suffer accidents or who have heart attacks or who come down with some other sort of infection or suffer some sort of injury. If hospitals are overwhelmed, these patients will not be treated, and we'll see rising deaths from other causes as well, and we've seen this in various parts of the globe. We've seen these sorts of knock-on effects of the virus. So we want to prevent hospitals from becoming overwhelmed. We also want to protect vulnerable populations. We know that this virus is spreading more rapidly and having a more significant impact on Black and brown populations in the U.S., on more vulnerable populations in the U.S. Because of their economic status, because of their housing status. They work in jobs where they have to show up to work, where they have to interact with people. They tend to live in communities that are somewhat more crowded, and as a result, the virus spreads more rapidly among these populations and kills more people among these populations. And we have a duty to try to protect them, or it seems we have a duty to try to protect them. We also know that elderly patients and patients with pre-existing conditions are much more vulnerable to this virus, and that they can't protect themselves without completely closing themselves off from the external world. And so we need to do what we can in order to keep incidence rates down in our communities so that these vulnerable populations can continue to live a life of some sort, can continue interacting in some way, can continue at least going out and getting groceries. And so we have all of these effects that we hope to bring about as a result of social distancing. That's the point of it. Without a vaccine or successful therapeutics, It's the only way we can keep the infection rate down. So we need to engage in these social distancing practices. In the next video, I'm going to start examining some of the reasons that we might have, that each individual person might have for engaging in these social distancing practices and for following the guidelines that are out there.